Over the last 24 hours, we have identified 1,341 new cases of COVID-19 in Alberta and completed about 16,350 new tests. This means our positivity rate currently stands at 8.2%. This is a continuation of the plateau in cases that I talked about yesterday. As the Premier mentioned, there are 742 people in hospital, including 137 who have been admitted to the ICU. These hospital numbers continue to be alarming. As I have said before, this pandemic has not stopped all of the other health issues that Albertans face every day. Babies are still being born, people are suffering from heart attacks and having car collisions. Every COVID-19 hospitalization is an additional stress on our acute care system. We each need to continue to do everything we can to help prevent one more person from ending up in hospital, for our health, for our loved ones, for our healthcare workers, and for the system that we all rely on. Sadly, 11 new deaths were reported to us in the last 24 hours. My thoughts and sympathies are with all those grieving the loss of family or friends from any cause. Looking to schools, there are currently active alerts or outbreaks in 456 schools, or about 19% of all schools in the province. Currently, these schools have a combined total of 1,943 cases. This number includes 129 schools on the watch list. While junior and senior high students are currently learning at home, these outbreak numbers do include junior and senior high schools for transparency and completeness. COVID-19 has taught us many things over the past year, including patience, perseverance, and perspective. But I think the biggest lesson is about shared responsibility. Just like no one measure alone can put an end to this virus, no one person can stop it either. The only way we can get transmission under control is by all of us doing our part. For the rest of the month, we all need to make good choices and to rigorously follow all legal orders in place. This includes not crowding into shopping malls or other retail locations. We have implemented capacity limits for a reason. It is essential that we limit in-person interaction and gatherings, including those that happen in malls. It is critical that you stay physically distanced from anyone outside your household, and this includes any time you are inside a mall. We will be reaching out again to operators this week to ensure they're aware of the new measures. And I also want to reinforce these are legal orders. If we don't see compliance, Alberta Health Services and law enforcement are able to take action. I also ask all Albertans to help out. If you see a mall is crowded, consider returning at another time or arranging for curbside pickup. If you are going shopping, go with just one person, or perhaps, if two, with only your household members.
Even though we've seen cases plateau, which is good news, we continue to see slight increases in hospitalizations. So let me just say that the plateau thankfully happened based on the policies we had in place in November, and that so we can reasonably expect that the difficult but more stringent measures announced a week ago today, which largely came into effect just this past weekend, will take us from a plateau to declining case counts to reduce pressure on the healthcare system. Our own timeline is this, Rick. I can't speak for the Mayor or Calgary City Council, but on behalf of the Government of Alberta, our timeline is the following. The restrictions we put in place this weekend will be effective for 4 weeks to give us enough time, hopefully, to make a real difference in reducing pressure on the healthcare system. We will then reassess those restrictions. If, heaven forbid, we've not been successful and the plateau starts to pick up again, notwithstanding these restrictions, we'll have to respond accordingly. But I'm truly hopeful that with the plateau we have now and a declining case in hospitalizations we expect over the next month, that we may be able to look at some targeted relaxations. By the end of March, we will have hopefully vaccinated 10% of our population, including the most vulnerable, the very elderly and frail, seniors in nursing homes, and frontline nurses and healthcare workers. That will be a game changer. It should result in a significant decrease in the fatality rate from COVID-19. But we won't be out of the woods at the end of March, because we've still got to move on to inoculate more seniors. The average age of hospitalizations is 60. I mean, a lot of folks in their 50s who are not passing away from COVID, but they are getting sick and ending up in hospital beds. So we'll continue to assess this month by month and week by week as we go through the first 6 months of next year. I do believe there is, look, it's not time to break out the noisemakers and the party hats right now by any means, but I do think we can realistically hope for a significant relaxation in COVID public health measures as we move from spring into the summer. Until we get community immunity, which likely will not be until the fall, we likely won't be able to eliminate all of the public health measures. But I'm not prepared to sit here and predict what policies we're going to need a year from now. I think it's important that we be just absolutely blunt with Albertans, that we're in tough right now. Things are going to start getting better if we stick to our the rules in the first part of next year. And let's hope that in the latter half of this year, we'll be back to much more something like normal.